I'm Eric Chemi, and this is Politely Pushy. Welcome to the show. Today, my guest is Dr. Colin Banas. He's an internal medicine hospitalist and chief medical officer at DrFirst, where his interests center on the role of big data and analytics, on patient outcomes, and on novel forms of clinical decision support. DrFirst has been a pioneer in healthcare technology solutions for over 10 years, offering a suite of services known as the Healthiverse that securely connects people at touch points of care to improve patient outcomes. So, Dr. Banas, do I need to call you Dr. Banas, or is Colin okay? Because I think you're the first doctor we've had on the show.
Oh, not at all. Colin is completely fine.
How do they refer to you in the office?
Both, but usually when people do say doctor, I say, please call me Colin. So I'm whittling it down.
Because I'm at the age now where the doctors are like my age, right? So as a kid, they were always much older than me. Now I'm at the age where, like, yeah, doctors are my age, maybe if not younger. And you see them because they live in the neighborhood and they, you play tennis with them. So it's awkward for me, even when they're like my peer, to not call them by Dr. So-and-so.
Yeah, I don't put on any airs. We're all friends at the office and we're friends now. So Colin is totally fine.
So tell me, how does I guess it's not that hard. How does the doctor get a job at a health tech company? But usually these health tech companies, it's like 90% tech engineers, developers, programmers, the technical guys, and there's always a couple of doctors floating around. Is that similar at DrFirst?
As far as doctors go, we have a few, but as far as clinicians, we have many. So the first thing I thought of was, how does a doctor get into this role? I fell into it. I fell into it about 20 years ago, working at an academic health system that had implemented a large electronic medical record. And lo and behold, they needed clinical input on some of the design decisions and changes. And there wasn't really any architecture for that. And so that's really where the field of informatics was born, was out of this notion that clinicians needed to have a say into how these solutions are used and architected and implemented. So DrFirst is a progressive company. Actually, it's 20 years in the making, actually founded in the year 2000. But we do have a number of pharmacists, nurses, social workers, even physical therapists, et cetera, in addition to a few doctors that are on the team. And so that really helps drive to a better solution, better adoption. Because the idea of an informaticist is someone who can translate the clinical into technical and vice versa. So it's really a bridging role. And I'm so thrilled that I fell into this role and that I've been able to join such a fantastic company like DrFirst.
So who is the customer, right? So healthcare technology, are you selling to hospitals? Are you selling to just the regular doctor's office, the normal one I go to in my town? Are you selling to the government? There are so many stakeholders, there's so many entities involved here. So what is the business model for DrFirst?
Yeah, it's all of the above. So DrFirst actually has its roots in e-prescribing. So if you go all the way back to the year 2000, before e-prescribing was even a thing, so back in 2000, we're still doing paper charts. We're still writing paper prescriptions. We're still faxing, although I could argue that we're still faxing today, which is a travesty and something that we're working on at DrFirst. But
we're still doing paper today. We're still doing a lot of it. A lot of it's good, but a lot of it is the exact same as it was 20 years ago.
I agree. And a lot of times we've overlaid a digital solution onto a paper process, which is really defeats the purpose. It can actually make it worse. But as an e-prescribing vendor, we were selling to small offices. We were becoming the engine for some of the larger EMRs to route their prescriptions. But over time, what started as an e-prescribing company actually blossomed into what you were referring to before, the Healthiverse. And it's a suite of innovative solutions that really center on patient safety, efficiency, satisfaction, and even communication. And so it started as e-prescribing, and now there's a whole portfolio of solutions, and we provide these solutions to any and all of those entities that you were referring to before.
The Healthiverse. I said Healthiverse because I wasn't sure if it's like universe. I didn't pronounce it perfectly, but what does that mean, the Healthiverse, right? Because
Yeah,
the
yeah,
metaverse, what's the Healthiverse?
yeah. We actually, even before the metaverse, we had coined that term, the Healthiverse. And the easiest way to explain it is the universe of healthcare is complex. It's complicated. And we're trying at DrFirst to unite all of the various touch points while keeping the patient in the center. So you'll see the tagline, Unite the Healthiverse. It really is this idea of combining our solutions across all of the entities in the healthcare space, whether it's payer, provider, of course, keeping the patient in the center, even pharmacies, and then also all of the other clinicians that get involved as well. And so, again, you imagine this patient at the center and all of these touch points. We want our solutions to make all of that communication and data transfer seamless and interoperable across all of the entities.
So what is your job as a doctor there on staff? Is it to be a salesperson, connect them to big hospital chains, big, PBMs, whoever it may be? Is it the job of, hey, I speak their language, I can talk to them? Or is the job more internal? Hey, let me make sure that what you're doing makes sense from a provider's point of view.
Yeah, it's both. I think the fun part is the innovation. And that's where I get to sit with the technical team, do that translation role, tell them, how these things would work in real clinical practice, put this button there. Oh, it should do this, that sort of thing. That's the fun stuff. But there's a portion of the role that is, I need to be the representative physician speaking on behalf of the company. So some of it is sales, not too much. Some of it is getting to speak at industry events. So upcoming at AMDIS, which is a sort of a CMIO community that I've been a member of for many years, I'm giving a talk out there. And so things like that are fun as well. So I wear multiple hats for the company, not just sales, not just innovation, sort of all of the above.
You mentioned e-prescribing. It's been going on now for about 20 years, but I think it's really started to take steam, especially during the pandemic. But we're seeing a lot of news stories these days of certain companies, tech startups, maybe over prescribing, maybe being very aggressive with, hey, we got to just keep churning out these prescriptions because the business model is unique, right? That insurance companies are typically paying more so than the patient is paying. So there's different incentive than a normal store, let's say. So what are you seeing trend-wise all of a sudden in this past couple of years? Do you feel like it's gone too far, perhaps, with maybe the ease at which certain drugs might be able to be gotten electronically?
No, yes and no. I guess that's a sort of a twofold answer. But so one of the things that we do have the benefit of is data. We have a lot of data. We can analyze trends. We can see where the industry is headed. Maybe even make some predictions. And so, undoubtedly, during the pandemic, we saw antidepressant prescriptions go up. We saw inhalers go up. As you can imagine, a lot of people early on thought the benefit of certain inhalers that you would use for asthma, for example, could be of benefit during COVID. And we even saw some opioid prescriptions go up because some of the restrictions and burdens about prescribing controlled substances were eased off during the pandemic because you couldn't go to the office, you couldn't see folks in person. And so there were some, there's always a few bad actors that can sort of bring us all down as providers, if you will. But I think the way we monitor as a company, the way the industry monitors, we're catching the bad apples and we're bringing that to the light, and then we're making appropriate changes.
I want to get into some other DrFirst questions in a bit, but I just while I have you on this topic, all the debate about COVID over the last couple of years, right? Masks, no masks, vaccines, no vaccines, social distancing, not, keep schools open or not, like all the debates. You are more informed than I am because you are an experienced doctor. You're working at a healthcare technology firm. What is your point of view on the pros, the cons, the balances, the compromises, at what cost that we as a society have gone for all of these things? Was it a big enough cost? Was it not enough of a cost? What's your perspective on the balance that we tried to strike as a country here?
I think it was an incredibly difficult line to traverse. And so as a physician and as a scientist, my motto was always to follow the science. And I realized that sometimes the science changed and sometimes the science wasn't exact. But I think we as a country did the best we could. I do think there will be consequences downstream. I have 2 small children. I know they essentially missed a year of in-person learning at a young age, which I think is super important. So there's catch up to be made for a lot of these things. But I'm not sure we had much of a choice based on how the pandemic was ebbing and flowing. And so it would be way too convenient to armchair quarterback this thing. But in the thick of it, the best advice was to follow the science and to stay very attuned to all of the things that were going on.
So going back to DrFirst, on your website, there's a lot of mentions of artificial intelligence, right? Every health tech company talks about AI. That's a big buzzword. It's been buzzy for years now, to almost the point now it's like a standard operating term. It's not even buzzy. It's like a necessary requirement to do your business. From your perspective, what does AI even mean to you now in terms of what you're doing, and how do you get past what does that even mean to anybody anymore?
Yeah, it's definitely lost its punch. And I think it gets thrown around too often. I think it gets thrown around in instances where it's not even truly quote unquote artificial intelligence. It may be something as simple as what we would call an algorithm before we needed to call everything AI. I will say, personally, I hate the term artificial intelligence. And so when I say AI, I'll usually change it to augmented intelligence, because I think what we've seen now is that the true AI solutions that we deploy in healthcare are never going to be a replacement for a clinician or a healthcare provider, but they can certainly, and we can prove it, they can augment the workflow. They can make them more efficient. They can make them safer. But do I think some AI algorithm that can read x-rays is going to replace the radiologist? No. But do I think that same algorithm can prioritize the work queue based on pattern recognition and say, oh, go look at these 10 x-rays first because there's something concerning here, and then intervene faster? Absolutely. I mean, that's been proven. And so it is getting played out. I'm not sure if you're familiar with the Gartner hype cycle, if you've ever heard of that.
Heard of it, yep.
Yeah. And so I think we got all the way to the peak, and now we're a little bit past what Gartner would call the trough of disillusionment, because we're actually seeing some real world applications, and none of them are nearly as high as the expectations for remember, Watson was going to cure cancer, and now Watson is no more, and the data has been sold off in order to at least further the AI mission.
Because I remember, you probably remember better, Watson had a deal with a major hospital, and I think it was kind of a debacle, and it was like, never mind, can we return this back to you? We don't want this here anymore.
Yeah, it's hundreds of millions of dollars. But this is one of the things that I also like to talk about when I talk about augmented intelligence, is that there are versions of AI that are, they all don't have to be a swing for the fences. In other words, you don't have to have AI solve sepsis or cure cancer. You can have AI automating some of the repetitive and mundane that has still percolated into the healthcare workflow. And just by automating some of those things with thoughtful oversight from the algorithms and continual learning, I think that's another tenet of AI, is that it needs to continue to learn. You can make huge impacts in clinician workflow, clinician satisfaction, and most importantly, patient outcomes and safety.
Do you think that you've had this job and that you've been in the tech side of it, you're seeing what's involved? Does it give you more confidence in our future or less? Because my point is this: now that you're in the tech, you're maybe saying, like the example you give, maybe it's very narrow. Maybe a lot of the changes that are going to happen in the future are smaller than we expected. Has this job in a way reduced your expectations, reduced your optimism for what will be possible in your kid's lifetime? Maybe the problem, now that you're part of tackling the problem from the tech side, maybe the problem is bigger than anyone could imagine until they get there.
No, I think our prior expectations were overinflated. Again, back to that Gartner hype cycle. And I think So before joining DrFirst over 3 years ago, I was the CMIO for an academic health system. So I was on the other side of the fence. I was, again, as I mentioned before, implementing these technologies and driving EMR adoption. Now that I'm on the tech side, if you will, the way that we focus it at DrFirst is actually focus. We're focused on the things that we know we can impact with the data and with the assets that we have now. And then from there, we're going to continue to grow and learn and think of the next round of solutions to implement. So I'm not jaded. I think that was at the sort of the undertone of your question is, am I jaded by AI? No, I'm hopefully excited.
Or less jaded, more like, do you realize the enormity of the problem? Or I don't mean, it's like, hey, I want to be wrong. I want to ask the question. I want you to tell me that I'm wrong. I'm hoping that I'm wrong. I'm hoping that you'll say, look, now that I'm in it and I'm part of this tech solution and I see exactly what it takes, you have a better sense for here's what the next 10 years is going to look like. Here's what the next 20 is going to look like. We'll be able to do X, but we won't be able to do Y. So I'm curious how your education has changed being part of it on the inside.
Yeah. So the quick answer is healthcare is way more complex than any of the health tech companies, I think, initially conceived. And so I think that's why you saw fits and starts with the IBMs and the Watsons. And, now there are tech companies starting to get momentum in the space, whether it's automation firms, whether it's even big data type companies like Oracle or Google. But I think the way to think of it is healthcare is probably 15 to 20 years behind some of the analytics and AI that you've seen in other industries, whether it's Amazon in retail or whether it's banking or aviation. So if you think back to where your Amazon experience was 20 years ago, it wasn't really there. They might have been a book company back then. But I think within the next 10 to 20 years, as we're picking up momentum, you're going to start to see similar experiences that we had in those other sectors.
What about the idea that tech is taking over healthcare too much so? So when someone comes in to see their doctor, see the nurse, it's a lot of staring away at the computer, right? No one's really looking at you. There's no eye contact. It's just you talking to someone, typing something into a computer. And you hear those complaints. I'm sure you hear more than me that, hey, no one's even talking to me anymore. They're just typing into a computer. What is the point? Why am I even coming here for this?
Yeah. So this is a beautiful use case for AI. So I think what you're referring to is what we a lot of times call the unintended consequences of digitization, whether it's too much screen time and not enough patient interaction, whether it's clinicians who have to take their work home because they can't complete their charting while they're in regular office hours. And so we affectionately call that pajama time. You're sort of dipping into your time with your kids in order to finish your documentation or your charting. And this is where the promise of AI and automation can really shine. So if you think about things like ambient listening, so think of your home devices. If I say her name, the one in my kitchen is going to actually respond. So
ambient listening always scares me because everyone jokes, is like your phone listening to you because we'll talk about something and then you see an ad on your phone for that thing. You're like, wait a minute. I didn't wait. What's going on here?
Well, in the healthcare setting, it's gonna benefit your provider and benefit you because there's literally technology now that can listen to our visits, discern my voice from yours, write the note or document all of the things that need, it's using natural language processing and things of that sort. And now my documentation time, the amount of time I need to be in the laptop, if you will, is reduced to almost nothing. And now I can spend all my time on you. Telehealth during COVID, I mean, that was the only option for a period of time. Doctors' offices were closed. And people were afraid, even if they were open, to go into the waiting room. And so we saw this explosion in the technology of telehealth during COVID. And I don't know that we would have been able to get through it without those sorts of technological advancements. And of course, now we've got that momentum and we're going to run with it and do even more with remote monitoring, with wearables, with things like that. And so do I think technology is taking over healthcare? No, I think the bureaucracy of some of the self-imposed things that we've done in healthcare, combined with digital solutions that were layered on top of paper, as I mentioned before, sort of, hit us for a doozy until we really got our bearings and said, we don't need to do it like that anymore. We can start to do it different.
So, and maybe you can't share this, but what is the typical cost of this type of solution? I don't know, like even the scale, is this like $1 million, $100 million? If somebody says, I want to get DrFirst, I guess it depends if this is a small, like a one person doctor's office, or this is a big regional chain or a big hospital, but like, give me a sense of the scale, the business side of how much it costs them, who's really paying, and they're the capitalism model of like, okay, if we buy this, what are they going to get for it, right? What's the benefit of it? And if they don't buy it, what are they losing? Is it competition? Do patients go elsewhere? Is it hard for them to hire? What's the reason for them to buy this? From a money flow point of view.
Yeah, and you have to remember, it really is a whole portfolio of solutions. So depending on your need, it can change. So we have a mobile prescribing platform, for example, called Eprescribing. Actually, massive adoption during COVID because people needed to send prescriptions via their phone and they weren't in their office, et cetera. That's a pretty simple subscription model, and that is not expensive at all the way up to an enterprise implementation of either our e-prescribing platform or some of our medication management solutions. And those typically can get priced by the number of beds in your hospital, for example. But none of the things that we're talking about are these massive break the bank investments, if you will. The solutions that I like to talk about the most in terms of the automation solutions, those are really meant to be small, easy implementations with immediate impact once we flip that switch to on.
Buzzwords, jargon. We mentioned it a little bit. AI. I know you've got a point of view on not using too many of them, right? When you're having these conversations, when you're working with when I say customers, but these healthcare providers and their patients, how does DrFirst as a company, how do you as a representative, how do you not use that many jargon buzzwords and not reference things like AI, right? Or interoperability is a word that I hear a lot. Patient engagement. I'm not really sure what that means exactly. POP. How do you get away from that?
It's hard. It's really hard because
that's not the answer I was looking for.
Well, and so I try to be very deliberate. So instead of AI, I'll try to say augmented or advanced. POP or POP health or population health. You can't get away with it, but you can start to. The problem with those buzzwords is that people tune out. They either they grow numb to them, or they discredit it because everybody has an AI solution or everybody has a pop health play. And so I try to be very deliberate in describing the solutions and, more importantly, describing the impacts. I think anything that we will talk about in terms of our solution suite can always back it up with actual real world examples and data. And so, maybe I'm talking about pop health, but I'll say, this is how you manage your cohorts of patients. This is how you can manage your chronically ill. You got to personalize it a little bit, and you got to find other words to convey the same meaning because, like I said, they might become numb to those.
What's your biggest hurdle right now in terms of getting your story out there, getting your messaging, your narrative out there for people that you need to understand what you do? What's the hurdle in terms of getting them to understand exactly what it is you do, what the company does?
I think the biggest hurdle, and one of the things that I'm so honored to be a part of with the company is getting shouting from the rooftops our real world successes. And so I actually have the honor of leading our applied clinical research division. And that is literally going to existing partners that we have and saying, look, we've implemented, X, Y, and Z solution. Will you share your data showing the impact, whether it's happiness, whether it's efficiency, whether it's being able to get a return on investment, or my favorite, did we make you safer? And we finally now have partners that are really wanting to open the kimono, if you will, and share that data. And then my team and I have the pleasure of actually publishing these things. And so we have 3 papers right now in peer review. And so the more real world examples, the more momentum that we can get as a company talking about our solutions and the real world impact, I think that's when we're really set for skyrocket growth. So it's a really excited time for the company.
I love it. Dr. Banas, thanks so much for joining me today. This has been a great show. Thanks. I appreciate your insights. Really interesting conversation. Thank you.
Oh, it was a pleasure. I'll do this anytime.
Thank you to my guest, and thanks for listening. Subscribe to get the latest episodes each week, and we'll see you next time.